Physical therapy is often misunderstood. Sometimes when I tell people that I work in physical therapy, they'll say to me, "Oh, so you just massage people, right?" Or they will say, "Oh, you're just like a personal trainer, aren't you?" Or they'll say, "Oh, you just torture people all day," or something along those lines. But the reason they're saying that isn't to be mean or to be demeaning in any way, but a lot of times they just lack an understanding about the profession.
Physical therapy is a brand. What we mean by this is it's what you think of when you hear a name. So it's what you stand for and what you're part of and what you do. So when I think of Nike, I think of athletics and fitness and activity. But what is the brand of physical therapy? Currently, when people think of physical therapy, they think of like massage or personal training, or oh, maybe you're like a chiropractor. So they think of other professions instead of what physical therapy is. So is our brand poorly defined? It's not maybe clear to people what our brand is. Compared to other healthcare services, physical therapy is a small brand or held with little regard. So when I tell people that I have a doctorate's degree, usually people are surprised or taken back because they don't realize we have that much schooling in order to be able to evaluate and treat patients.
And I think that physical therapy does play a crucial part in the healthcare system, but I just don't think that a lot of people realize it. They don't understand how much skill or knowledge it takes to become a physical therapist, and they don't even really know what physical therapy is. And on the surface level, that's totally okay, but on a deeper level, I feel like it limits the profession and it limits the value that we can actually provide in physical therapy if people don't advocate for it and change the perspective that people currently have of physical therapy.
In the past, physical therapists would get their patients directly from physician referral. If a patient had back pain, they would go to their doctor, and if the doctor decided that they wanted to prescribe physical therapy, then the patient would come to physical therapy. But this is changing. As of January 1st, 2015, all 50 states, the District of Columbia, and the U.S. Virgin Islands allow patients to seek some level of treatment from a licensed physical therapist without a prescription or referral from a physician.
What this is saying then is that patients now have the ability to go straight to physical therapy. They don't need to go to a doctor first to get approval or to get a prescription, but they can come straight to their physical therapist. However, there are still some restrictions against this because they don't recognize the professional training it takes or the expertise it takes to be a physical therapist. But even when people do have the option to go to physical therapy first, I feel like a lot of times they will still go see their doctor ahead of time. And why is this? Is it because they trust their doctor more? Is it because they just don't know that they can go straight to a physical therapist? Or is it because they don't see the value in the field?
Regardless of the reason, how can we make physical therapy a stronger brand and give people a different impression of what we do? If people don't have to go to their doctor and they can come to physical therapy directly, how can we share with people the benefits of physical therapy and make this feel like a viable solution?
We had a patient who came to physical therapy recently, and she was talking about her friend who had gotten hurt, and she asked her friend, "Why haven't you gotten an x-ray yet?" And she was all concerned because she's seen an x-ray was a viable solution to her problem. So how can we get that same impression in physical therapy? How can we get people saying, "Oh, you haven't been to physical therapy yet? That's crazy." Or, "Why haven't you talked to your physical therapist about that yet?" How can we get physical therapy to be a stronger brand? And also, how do we position ourselves as the experts in this field? How do we change it from, "Oh, I didn't realize you have a doctorate's degree," to being, "Oh, I realize I'm sitting with a doctorate level musculoskeletal specialist right now." Like, that sounds like a way stronger brand than not even realizing the education it took to get there. People ask me sometimes what I think the field will look like 5 years down the road or 10 years down the road. And honestly, I think it's what we do now that's going to influence how it looks down the road. If we don't really do anything to promote the field, or if people really lack an understanding of how we can help, then I think 10 years down the road, the profession will become more obsolete. But on the other hand, if we learn to show people the necessity of physical therapy, and if we can explain clearly what physical therapy even is, then I feel like the profession will move forward from here. In the future, I picture physical therapy being the first place that people go to when they have a musculoskeletal injury, or they have a neuromuscular injury, or they have vertigo, or anything related to this field that we can help someone with. I picture this field being the first place that people go to get care. Kind of like going to the dentist. If every time I had a toothache or if I needed a teeth cleaning, I had to go check in with my doctor first and then get sent to my dentist, I feel like that'd be the strangest thing ever, and it doesn't really make any sense. But this is how it is with physical therapy. Like if someone's playing basketball and rolls their ankle when they're out on the court, usually the first place they go to is their doctor, and then they get sent to physical therapy. We need to do a better job then at showing people the benefit of what we do and building up our brand so that people will want to go to physical therapy first. There it is, guys. Those are my thoughts on how physical therapy is misunderstood and how we need to build up our brand in this profession. Let me know in the comment section, what are your guys' thoughts on this subject? Let me know what you guys are thinking, and I'll see you on the next one. Peace.